Let's talk about the alcoholic. There are three main characteristics that almost all alcoholics have, and addicts too. But for simplicity of this presentation, I will just use the term alcoholic because saying alcoholic-addict is way too difficult. Number one, the first characteristic that almost all alcoholics have is a sense of restlessness, irritability, and a sense of uncomfortableness that only a drink can fix. Why is the alcoholic so restless? Issues that include boredom, loneliness, anger, depression, anxiety, feeling stressed, feeling resentful, unloved, underappreciated. The alcoholic addict may be agitated by relationship difficulties, employment challenges, health problems, any number of things. So, as you may have picked up, characteristic number one for the alcoholic is about self-medicating. The second characteristic of the alcoholic is what the late Dr. Silkworth termed the phenomenon of craving. This characteristic is unique to the alcoholic in that once he or she has an alcoholic beverage, they will want another one, and another one, and another one, and another, and another, and another. The phenomenon of craving is one of the defining characteristics of an alcoholic. This is what separates the alcoholic drinker from the non-alcoholic drinker. The non-alcoholic drinker does not develop this type of craving. He or she consumes alcohol like any other beverage. They may have one or two alcoholic beverages, then they become satiated, content, and they may say, enough, I had enough, but not the alcoholic. The third characteristic of the alcoholic addict that is always present is the obsession of the mind. The obsession to drink is what gradually shifts the alcoholic's life from being somewhat balanced to becoming more and more obsessed with drinking. The obsession is what keeps the alcoholic drinking, no matter what type of negative consequences he or she may have. No matter about health problems, relationship problems, financial problems, legal problems, whatever they are, he or she will return to the drink. As you can see, the obsession to drink for the alcoholic is powerful. So now let's briefly cover substance abuse treatment. Substance abuse treatment for the most part is to help the alcoholic address the three characteristics we just covered. One, the program should stress the importance of staying away from that first drink and to help the alcoholic come up with strategies to avoid that first drink. That's characteristic number two that we talked about. If you don't take that first drink, you won't get drunk. If you don't take that first drink, the phenomenon of craving won't kick in. The second thing treatment programs should do is to help the alcoholic addict to identify and start addressing their feelings of restlessness, irritability, and their overall sense of uncomfortableness that we talked about. This addresses characteristic number one. As I said, start the process of addressing these issues. As you would imagine, the alcoholic will be presented with these type of challenges throughout their life. And so the treatment program should teach healthy strategies to overcome these, as opposed to turning to the drink or the drug. Lastly, the treatment program should teach the alcoholic about triggers and to teach him or her about the obsessional nature of addiction, and to go over strategies to prevent obsessive thoughts from leading the alcoholic back to using. This addresses characteristic number 3. This may include time management, avoiding certain people, places, and things, goal setting, going over the one day at a time concept, utilizing the 12-step community. All of these are strategies to combat the obsessional thinking and behaviors that go along with alcoholism and addiction. I hope you found this short presentation informative. If you did, give me a thumbs up. And if you're interested in other presentations like this that include breaking the addiction cycle, learning about triggers, and why do people relapse, hit the subscribe and the notification button. That way you'll be notified when I put out a new video. Take care, be safe, and see you in the next video.